The chair moves House File 1501 before the committee with the chair's intent to lay the bill over for possible inclusion. Representative Murphy, to your bill.
Thank you, Mr. Chair. Appreciate it. So this is House File 1501. 1501 appropriates money to the general fund for the Rare Disease Council, which we're under statute to do. It appropriates money for the 26 and 27 year cycle. And it's in the area of $342,000 to run the Minnesota Rare Disease Council. It's interesting at the Minnesota Rare Disease Council, it's its own agency. And I'm actually on the council there, along with Representative Ryer from the House and also 2 senators. But it's a unique environment that we are actually voting members of the council, and we have some real oversight and availability to really help with the council. We are advisory. We're a great source of information for those who struggle to find it. Our efforts shorten the time of diagnosis to those that urgently need it. We help accelerate research through our participation in the process. The council is advised of key industry players made up of expert members. In Minnesota, we are actually one of the leaders, a world leader, with the help of the University of Minnesota and the Mayo Clinic. We stand alone in the country as one of the premier councils for rare disease. We've been advised about and advocate for cutting edge technologies like gene therapy. We've been able to accomplish great things with sickle cell anemia and hemophilia. And so it's a great opportunity for Minnesota to lead, and really appreciate your consideration of this bill. Thank you.
Representative Murphy, I believe you have a testifier. If they could introduce themselves for the record and proceed, please. It looks like Aaron Barnes.
Erica Barnes.
Erica. Oh, we're close. Get a point in horseshoes. Go ahead, Erica.
No problem.
Introduce yourself, and I would ask you to keep your testimony to 3 minutes.
Okay. Chair Backer and members of the committee, thank you for the opportunity to testify in support of House File 1501, which would establish Minnesota RDAC's current fiscal year 25 budget as the permanent base. My name is Erica Barnes, and I'm the Executive Director of the Minnesota Rare Disease Advisory Council. The Minnesota Rare Disease Advisory Council is a state agency established in 2022 whose mission is to improve care for the 1 in 10 Minnesotans living with a rare disease. Our aim is to provide comprehensive policy recommendations related to rare diseases to legislatures and other state agencies, develop support tools for the medical community, and convene and unify small patient communities working in isolation and often duplicating efforts. When the council transitioned from the University of Minnesota, we worked closely with the small state agency resource team at Minnesota Management and Budget to identify a budget that would allow us to meet all of our compliance requirements associated with being an agency, as well as what we would need to execute on our directives that are laid out in statute. There are roughly 10,000 rare diseases, and when considered collectively, they affect 25 to 30 million Americans. While the underlying causes are varied, the striking commonality among these diseases is the barriers to care that an individual faces when encountering our healthcare system. At every point along the healthcare journey, rare disease patients face unique barriers over and above what these individuals with common diseases face. From years-long delays in diagnosis to a lack of a primary care doctor who has any knowledge of the disease, to only 5% of rare diseases having any FDA-approved treatment, it is no wonder that Abby Meyer, the founder of the National Organization for Rare Disorders, once said, "Families affected by rare diseases represent a medically disenfranchised population that falls through the cracks of every healthcare system in the world." And these inefficiencies in diagnosis and management represent a significant cost to our healthcare system as well. I submitted a document for your review that talks about the cost burdens of rare diseases. Due to their medical complexities and the difficulties providing coordinated management, a recent NIH cost burden study found that healthcare costs for people with rare diseases are 3 to 5 times greater than the cost for people with more common diseases. So it's costing the state of Minnesota not to prioritize the management and care of these patient populations. However, and ironically, in the last several years, the rare disease community has become ground zero for some of the most innovative medical advances in decades that are transforming medicine as we know it. Treatments such as gene therapy have opened the possibility of greatly alleviating or even curing diseases which were once out of the reach of medicine with a single administration. But these disease-modifying treatments come with high upfront costs and shatter the current reimbursement paradigms that are more designed to pay for chronic diseases over a lifetime. In order to take this transformative therapy from the lab to the clinic and actually deliver it to the people who need it, we will have to identify policies to reshape our healthcare delivery landscape. The Minnesota Rare Disease Advisory Council is grateful for the funding from last session that allowed us to operate on the budget that we identified as necessary to execute on our work. With that funding, we have been able to convene the rare disease community more regularly. I'm so sorry. So there's a lot to be done, and I just ask you to please fund the Rare Disease Advisory Council. Thank you so much.
Thank you, thank you. Time always goes quicker than we want, so, and that happens when you work with Representative Murphy, too. So, would there be anyone from the public that would like to testify? Okay, seeing none, I close the public testimony. Members, I open it up to questions and discussion. First on the list is Representative Hewitt. You have the floor.
Thank you, Chair Backer, and this is more of a statement, and I really appreciate Representative Murphy and Representative Ryer. We as members have very limited time, and we're assigned to these boards and in committees like this, and I really appreciate the fact that you're actually engaged with it, and that's really important because you are bringing their legislation forward, and you are our eyes and our ears on this, and so thank you, and thanks Representative Ryer. Thank you, Chair.
Yeah, and just to let people know before we go to the next one, we do have two representatives that are on Zoom because they couldn't make it in today. So with that, we have Representative Liebling. Go ahead, please.
Yeah, thank you, Mr. Chair, and thanks for the presentation. I really have questions about the budget, and the bill is about the budget. And Ms. Barnes, maybe you could just explain like what the current budget is. I thought you had like an ongoing budget, but the budget, so the bill before us, is that additional money? So it almost doubles your budget, as I understand it. Could you please explain like why you want your budget to be doubled?
Sure.
Go ahead, Ms. Barnes.
Chair Backer, Representative Liebling, so the current amount that was appropriated last year was $668,000. Part of that is an ongoing base, and the rest of it was a one-time appropriation. But that was the amount that we identified. It's very comparable to other state agencies. In fact, it's on the low average end of other state agencies. And I think I submitted a document with line items of how we're using that money. I can go into a few of those details if you would like, but that was the money, that's the amount that we've been asking for since we were established in 2022, and we identified that at that time. So we've been trying to get that amount that was initially identified. So it is that the amount that the 668 is what we're operating on this fiscal year.
Follow-up, Representative Liebling?
Yeah, thank you, Mr. Chair. Well, I mean, we are here to discuss the budget, I assume, because we have a budget bill in front of us. So I don't know, I don't think I got that document, and I'm not sure if the committee got the document, but I would like to understand since you're asking to double your budget, and I understand we gave you a one-time appropriation last time in addition to your base budget. So I do think we need an explanation of, what you plan to do that you're not doing now.
So the base amount that's ongoing is $326,000, I believe, and then the $326,000 that's ongoing. And then last legislative session, we've been asking for the 668. Last legislative session, $342,000 was given as a one-time. We're looking to get that full amount so we can continue the work that we started, that we were appropriated last legislative session. So yes, in one sense, it's doubling it from what we were appropriated, but in the other sense, it's what we've been asking for since we were established in 2022 as what we identified as needing for our work. If we don't get that amount ongoing, then we'll go back to having 1.8 FTE. So before the one-time appropriation, I was operating with 1.8 FTEs. State agencies typically have an average of 4 FTEs to do the work. And there are some programs that we initiated with that amount that we would have to just stop doing if we go back to the 326,000.
And members, this bill will be laid over just because of our timeline. I'm going to go to our next member question, which is online. We have Representative Hemmingson Yeager. Go ahead, please.
Great, thank you, Chair, and thank you, Ms. Barnes. I just want to make a comment and just say that I have really appreciated their collaboration and their partnership, my first biennium and ongoing. Having a council of experts across the lab, across the clinic, and across all of the policy areas has been extremely valuable in keeping up with this crazy cutting edge technology and giving real tangible advice as I continue to work in the genetic and rare disease space. So I just want to give my full support for this bill. Thank you.
Okay, members, due to our timeline that we have here, I am going to have Representative Murphy please close on your bill.
Thank you, Mr. Chair. I would just like to say that, this is a very well-tuned machine. Ms. Barnes has done a great job with directing this out of the chute as a brand-new agency, so certainly isn't a big ask for what we're doing. And we're cutting edge, and Minnesota is an industry leader here. And so we want to make sure that we take advantage of all of that. I have a personal story with rare disease, so this was something that I thought was interesting, but I didn't realize until after I was in it that actually I have 3 kids that would all be classified as having a rare disease. It was the same disease. It was febrile seizures, and to be a rare disease, you have to be less than 200,000 in the United States cases. And so we went for a long period of time from when our child was 1 year old to about 6, and he would have seizures. And we sought a lot of help. And then we ended up, and when he was 6, 5 years later, we ended up at the Mayo Clinic. And they said, we can fix this. And they also said that the young man sitting right beside him has the same issue, but we're so glad you're here. And so when it comes to rare disease, it's really about diagnosis and making sure that people are advocating so that these groups get together. Because when you have 200,000 in the country, you don't know many of them. And they don't know, and the doctors don't know it either. And so it really was a big help. That changed his life. Today he's an engineer with SpaceX. And so it completely changed his life. And it completely changed us. We couldn't even send him home with anyone when he was young because they had to know what to do. So rare diseases are real things. We are cutting edge with our technology today, and we can make a huge difference with this. So this is an important bill, and this is an important ask. So thank you for your consideration.
Thank you. Thank you, Representative Murphy and Director Barnes. The chair lays over House File 1501 for possible inclusion in the omnibus bill.